All right, sweet. Well, thanks for letting me come and talk about our little nerve block program that we have in the community. My name's Dan Zeccola. I'm one of the docs at a community site here in Denver. And he didn't know this before this came up, but this is also Pete Al-Sharif, who is one of our former ultrasound fellows who now works with me in the community. And so we're going to drag him into the conversation about doing nerve blocks in the community. That, by the way, his middle moniker, the Go Hang a Salami, I'm a Lasagna Hug. That is my favorite palindrome. Just think about that for a minute. So first, I wanted to start with kind of a fun case that happened this week. My mom is a 76-year-old lady, and she is here visiting us in Denver right now. And she was going down my basement stairs with some slippery slippers and slipped and fell on the stairs. And since then, she's been having significant amount of pain sort of on her upper back. And so I did, what any good son would do, which is grab Matt Bersinti's IQ3 butterfly and brought it over to my house and took a look, and I found a couple of these rib fractures here, unfortunately. And so continuing to do what a good son would do, I broke out our massage table that we bought for our blocks teaching sessions with that IQ3, as well as a small mountain of ropivacaine. And then put in a thoracic erector spinae plane catheter in my living room. So that we could better treat her pain. This is what it looked like, kind of lying on the table. You can see where the entry point of the catheter is, sort of in the mid-thoracic area there. The entry point being quite a bit lower because I like to tunnel them a bit so that they don't pull out so easily. This is our text thread in regards to the catheter. Patient reports 75% of pain relief, now insisting on making eggplant parmesan, which one of our hive mind correctly pointed out is a high specificity functional outcome. And this is what it looks like. She's been walking around for the last 2 days for that, and twice a day, I'll walk over with a 20 ml syringe of ropivacaine and say, "Hey, mom, hold still for a second," and put the 20 mLs of ropivacaine in there. And I got to tell you, it has been absolutely amazing for her in terms of pain relief, and has only had to take one oxycodone left over from when my wife got oral surgery. All right. So let me tell you a little bit more about my community setting where I'm working. I work in a large tertiary referral center in Denver. It's not a big trauma center. It's a big medical and like cardiothoracic vascular center. This is our little hospital here, St. Joseph Hospital. We have developed over the past 5 or 6 years at our hospital a block program where we're doing a fair bit of blocks in the community. I think one of our strengths is like just our sheer volume of blocks that we've been able to do. I pulled up just a list of sort of all the blocks that I did personally in the last 6 months at our hospital. And because it's a very RVU based system, it's very easy to get this kind of data because your billing company is going to be really interested in how many procedures you do. So I in the last 6 months, I've done 295 blocks. And that's about average for us. And it's probably going to double because this character joined our crew here. So that's probably going to double, and maybe even more with Katie on board as well. Moving forward. So we're going to be doing, something in the 500 blocks every 6 months range of procedures. You can kind of get a see here of like all the different blocks that we're doing. Vast majority of them are thoracolumbar ESPs. That said, quite a bit of paravertebrals. And then Surprisingly, the ones that bill the best, by the way, this little tidbit, are those sphenopalatine ganglion blocks. So those bill better than any other block. All right. And then if you multiply that by how much we get assigned, and every hospital is a bit different in terms of how many dollars per RVU you end up getting. It's, for me personally, it's been about $30,000 a year more than I would have gotten if I weren't doing blocks. So I know everybody likes to talk about the sort of the hard aspect of doing blocks in the community, because everybody's worried, well, it's going to slow me down, so I'm not going to be making as much money. I'm not going to be able to be productive as much as possible. The other thing that our company does for us is it also gives us this RVU worksheet. A lot of numbers here. You don't have to worry about that. But basically, along the bottom there, that bar graph is every single one of the providers in our group and their RVUs per hour. So the higher RVUs per hour, obviously more productive, lower, less productive. If you look at that bottom, the left end of the graph, you're going to see that there's kind of two RVU producers that stand out right there. And those two RVU producers, in terms of RVUs per hour, are actually myself and Pete here. And we're seeing the same number of patients per hour as everybody else.
For me, a little less.
Yeah, a little bit less for him. And he's actually at 11. So, so we're not, it's not like we're just exceedingly productive humans in the ER from a general standpoint. It's just that we've been able to incorporate this practice of doing nerve blocks regularly for our patients into our practice. And this has been very beneficial for us in terms of our bottom line, and as well as, the collections for the department, that sort of thing. With this block program, we've got a couple of areas that we're looking to expand beyond just doing blocks in the ER. So we did just get assigned a block nurse from Intermountain Health, and she's going to be doing some follow-up with patients, calling people to check for peripheral nerve injuries, and also to ask them about the duration of effects. Because one of the interesting things that we found, especially with these lumbar ESP blocks, is that people are getting durable pain relief from a nerve block that ostensibly should only be lasting 12 to 18 hours. And so I have many, many patients that come in and be like, oh yeah, I remember that nerve block you did for me. Well, that was 6 months ago and I'm still doing great, that kind of thing. Certainly it's not 100% of the cases, but I would say it's actually more people who get durable relief than people who don't. And then we do have a proposal to our C-suite right now to try to develop a dedicated service, kind of similar to what which Rich Slama has out on the East Coast, and possibly even to get an outpatient clinic day. Our ER right now is planning on building a follow-up clinic for the ER, so sort of like an outpatient clinic that's staffed with PAs, NPs, family med, that kind of thing, to have close ER follow-up. And I think one of the ideas in that is to have a nerve block follow-up clinic day for people if they need a repeat nerve block, or if they need management of a catheter, if we place one, that kind of thing. That's all the hard benefits of doing nerve blocks in the community. For me as a community doc, though, you could take away the $30,000 a year, you could take away all of the, benefits in terms of what I feel like I'm doing for my patients. But for me, the biggest thing about being able to be somebody who's doing a lot of nerve blocks is the way that it's helped me develop community and get excited about doing emergency medicine again. It's easy to get burned out in the community. It's all about moving meat. It's all about, your bottom line, your RVUs, your patients per hour. But this special practice of doing nerve blocks in the community has really helped me to join a bigger, broader community of human beings who are doing this. And so, I have gotten to work with some legends of this community, like Dr. Dreyfus. We got some former and current fellows. Sorry, Felipe, don't have your picture. Some characters who are currently in this room right now. Some ultrasound directors of other places. Matt Rashenti. And we've just formed like a really fun community. I don't know if anybody has any way to help ChatGPT, but like they randomly put this like small human in the front row. I'm not sure who's that supposed to be. Is that Shibata? Oh, she is kind of small. And also, you know, helped me as a community doc connect more to the academic community that's happening in my city. So I, you know, get the privilege of working with and teaching residents and having 30 people in my living room doing interscaling blocks has really re-energized me as a physician and working in the community as well. All right, so I will unshare my screen and then Pete, did you have anything you wanted to add to that?
The one other thing, I mean, just like in terms of soft things, like I just love being at the bedside and having an excuse to like chat with patients sometimes, like, you know,